Okay, so more good news for today. So let's talk about a vending machine in Brownsville, Brooklyn that has a unique what's the word products. So there instead of let's see, where is it? So instead of the usual vending machine products, they have um, Naxalone kits, fentanyl test strips, birth control packs, and baggies containing tools for safer smoking and substances like crack cocaine. Smoking of substances like crack cocaine, methamphetamine, and heroin, and it's all free. Residents just have to enter their zip code and make a selection. Now, to say that's a unique, um, unique, oh, what's the word? Selection of items is putting it mildly. I mean, don't get me wrong, both are necessary, but it's just weird that they put them all in one vending machine. Maybe make two separate ones. I don't know. I just, but it's still, I still like that they're free supplies. The machine is the first of its kind in New York City, designed to help reduce drug overdose deaths and mitigate other crises by giving residents free 24/7 access to life saving equipment, resources, and information. This is more than just a vending machine. It's a gateway to services and support and recovery, said Dr. Ashwin Vasan, Commissioner of the city's Department of Health and Mental Hygiene, which is running the pilot program in partnership with the long-standing harm reduction and social services nonprofit Services for the Underserved. Three more machines, which cost about $11,000 each, are slated for installation in other areas hard hit by drug use and overdose deaths. Vasan hopes to see the program expand even further. We're very optimistic that this could expand beyond four, he said. This is not a be-all, end-all in our fight. This is one more arrow in a quiver, and we need lots of arrows in that quiver to respond to this ever-growing crisis. So I'd love to see this expand as far as wide as possible so that it's available everywhere. And so now we seem to have forgotten the birth control part. I mean, again, free access to things that could help people, it's always welcome, but oh, it's just weird combination of supplies. In addition to the goods it offers, the Brownsville vending machine displays QR codes to help people look up services and resources in the community. Its location was determined by an analysis of overdose deaths in the neighborhood. This is just your first stop on your way to hopefully getting care and getting housing and getting all you need from SUS or any other organization in New York City, says Rebecca Lynn Walton, Chief Strategy Officer for Services for the Underserved. It shouldn't be luck or privilege that gets you into services. It should be easily accessible to everyone we know and love in New York, as long as you happen to have a smartphone, which not everybody has, but the city is experiencing a spike in overdose deaths. According to data from the Department of Health and Mental Hygiene, 2021 set the record for the most overdose fatalities, with 2,668 recorded citywide. In comparison, 2020 saw 2,103 overdose deaths. About 80% of those deaths each year were caused by fentanyl, a potent synthetic opioid up to 50 times stronger than heroin. Citywide numbers for 2022 are still being calculated, but with 1,370 deaths recorded in the first half of the year, it's on pace to beat even the record high from 2021. Now, I hope those QR codes also help with, because if they're giving birth control as well, it would be nice if there were services for that as well. QR codes for that. In Vassan's view, a problem so persuasive needed a creative solution that can put life-saving fentanyl overdose antidotes like Naxalone, also known by the brand name Narcan, into the hands of as many New Yorkers as possible. The vending machines are a well-known entity. They're a well-known device. People stop and look and see what's in there, he said. I think they'll be surprised to find that this is a public health vending machine. I think that it's a great thing. It will start conversations. Hopefully that get people talking about our overdose crisis and what they can do to engage. Which is true. I mean, I do not use vending machines. I still look what's in the frickin' vending machine. As part of Monday's ribbon cutting, Elon Quashie, director of the Opioid Overdose Prevention Program, demonstrated how the machine works in real time by placing its inaugural order. Seconds after entering his area code, he held a small blue Naxalone kit, complete with how-to-use instructions. Wait a minute. Do you have to put in your area code or your zip code? Because earlier in this article that said zip code. Now it's saying area code. Did my mother write this article? I know that she gets confused about that. The Big Apple isn't the first place to try the vending machine tactic. The first machine was installed in Copenhagen, Denmark, Vassan says. Since then, Philadelphia, Las Vegas, and Cincinnati have unveiled their own versions. Data on how well they worked was not immediately available. We have to address the root causes of substance use, not just the needs of people who are using now, Vatsan said. How do we prevent people from using in the first place? This is why we made overdose responses a core pillar of our mental health plan for the city. It's to formally bring these together. Now, I appreciate this article, but why bring up that it also has birth control if you're literally going to ignore the birth control part of it completely? And, it was just a one sentence mention, and then they concentrated on drug overdoses, which again, that is an important aspect, but why bring up birth control if that's literally going to be just your only sentence? I mean, just to mention that it's there, which, like I said, is a good thing. And I hope there's a QR code as well for that to help people who need services for their reproductive health. Not just for women, but for men, because men have reproductive health. I mean, after all, it's not just the woman who gets pregnant on her own. So yeah, it would be nice to have not just birth control, but I hope there's a QR code for services for birth control. Whether it be just that you need free birth control, but you might have other questions about reproductive care. I hope there's a QR code for sources for that. It would also be nice to have information on these QR codes, how to administer Narcan, how to use the fentanyl testing strips, because not any old Joe Schmo can walk down to the vending machine, take it out, and immediately know how to use it. So hopefully there's instructions either on the packaging in the vending machine or that there's a QR code explaining how to use it. And hopefully the person hasn't died in the meantime. Um, let's see. Other than that, that's all I have for this video, and I will see you guys in the next one.